Retina Rounds podcast number 12. Wrapping up our week of videos from UCLA vitreoretinal surgical fellows, Retina Rounds is honored to welcome Dr. Tara McCannel. Dr. McCannel is a professor of ophthalmology at the Stein Eye Institute at UCLA, where she serves as the director of the Ophthalmic Oncology Center, chief wellness officer, and the vitreoretinal surgical fellowship program director. Dr. McCannel talks about her path to ophthalmology, how fellows can prepare for success, and the importance of incorporating wellness routines to avoid physician burnout. Let's check it out. Well, welcome everyone to the Retina Rounds podcast. This past week, we have been featuring surgical videos from the UCLA vitreoretinal fellows. And today we're pleased to welcome Dr. Tara McCannel, the director of the UCLA Vitreoretinal Fellowship Program for vitreoretinal surgery. Thanks, Dr. McCannel, for joining us today.
Thank you, Pradeep, for having me. It's fun to be here and look forward to sharing what I know about our program.
Absolutely. So, Dr. McCannel wears many hats in the department at UCLA. In addition to being a professor of ophthalmology, she's also the director of ophthalmic oncology at the Stein Eye Institute and is the chief wellness officer for the Department of Ophthalmology. So, Tara, I was wondering if you could tell us a little bit about, your journey to ophthalmology, to retina, and then even to a more subspecialized field of ophthalmic oncology.
Yeah, no, that's one's journey is always very colorful and it's never really as we planned. So a lot of people ask if is it my dream to treat people with eye cancer? And I've always thought about cancer and helping people in this field, and it actually is not. When I started medical school, I didn't even know that ophthalmology was a field, and I stumbled upon it while looking at a course elective book, and I did some rotations. And ophthalmologists are the happiest doctors. So you might have noticed this as well, but everybody loved what they did. People were excited to teach, and it was just like an experience like no other rotation that I've been on. And so that really woke me up, because I was thinking of surgery and, a different lifestyle. But the people in ophthalmology were really fantastic, and they continue to be. Your colleagues, our colleagues, they're just great people. They have very well-rounded lives. They love what they do. And I think this is what we need to look for when we're, making big decisions about career choices, is really not necessarily the content of what we're going to be doing, but what are the people like in the field? Because ultimately it's the people that we spend our time with, that we get to see at meetings, that we get to collaborate with, that really enriches our lives. So that was my first glimpse into ophthalmology. And surgical retina, it was my first rotation as a resident. And, I didn't even know how to take intraocular pressure. So looking at the fundus and doing examination was something that just really threw me in there, and really enjoyed it. And, doing, ocular oncology, I wanted to focus on sort of neovascularization, macular degeneration. That was sort of my plan for research. And then an opportunity came up at UCLA where Dr. Bradley Stratsma and team in ocular oncology, they were looking to find someone who had an interest in ocular oncology, and it was a way to get it to UCLA. And so I started learning about ocular oncology really deeply as I was a fellow, and kind of came and really have learned to love ocular oncology and all the challenges that our patients face. And I think back and I think, just you need to be open-minded. You never know what opportunities there might be. You might have in your mind, I think it's difficult to have a certain disease years in advance, because you don't know where the field's going to be at. You don't know where the opportunities are. I think even today, for an example, hereditary retinal degenerations present a huge opportunity now, whereas, 10 years ago, there really wasn't a lot we could do for our patients. So it all depends on what's going on around you, what things are just speaking to you, the people that you meet in these intersections in life. And I've just been so fortunate to meet wonderful mentors and be in ocular oncology in a time where there is so much changing and that we're understanding, and sort of get to be a part of that and bring that to patients. So, it's just, you sort of have to see what there is and just go with it. And that's sort of what I've done.
No, absolutely. I think 2 points that you made are so critical and real pearls for our listeners, which is Our professional lives are largely going to be dictated by the people around us, and finding a group of people that you mesh with, that you enjoy spending time with. You're right, is just as important, if not more important, than the nature of the work that's being done. And then, yeah, being opportunistic, taking, stepping through doors when they open, and being flexible, I think is super important throughout one's professional career. You've been involved in a number of innovations in ophthalmic oncology. I wonder if you might speak a little bit to some of the innovations that you've helped to bring to this field.
Absolutely. Yeah, I'd love to speak about that. One of the things when I started, there's really, I think of three things that I'm going to tell you about. So the very first thing was when I started at UCLA in our retina division, no one was doing tumor biopsy for prognostication. And it was felt that it was dangerous to put needles into cancers of the eye because of this theoretical risk that we could spread the tumor in the body. But there never was any data on that. And we already knew, like 10 years before I started practice, that ocular tumors, ocular melanomas, had good and bad prognostic biological markers. We already knew that, but nobody was using that to educate patients or to inform patients about what type of risk they had by simply taking a tumor sample. I think people, when they got enucleated in some places, could get that, but that was not standard. And I just thought, if I was a patient and I could know if I had a high risk or low risk type of melanoma, wouldn't I want to know that? And so that's when we started doing biopsies. The very first tumor biopsy for prognostication in North America was performed at UCLA. And since then, throughout a lot of controversy, a lot of people thought it wasn't a good idea, partly because, well, there's no medical treatments if you get this information. So why would you do it? We're sort of forgetting about the patient. So I do a lot of my research in health psychology and the value of information and how information improves health and better outcomes. And it was very clear in our data that even though this didn't affect patient medical care, people want this information because it empowers them, it allows them to make choices. And honestly, I kept thinking, do we need to have a study to show this? But we do. In medicine, a lot of changes don't happen unless there is data. So, now doing biopsy for prognostication when we treat melanoma is really standard of care. And patients who get their melanomas treated and who don't have a biopsy, it is really far and few between. So this is now something that everybody does, and I'm thrilled that patients can get this information. I think the second thing that we are very proud about doing at UCLA is that we don't have any good treatments to prevent radiation retinopathy. There really is nothing. People have tried anti-VEGF, but that does not prevent sort of once the radiation affects the tumor cells, affects the retina, we can't really backpedal on that. The damage has been done. So what we started doing in mid 2012 or so, we started putting silicone oil in replacing the vitreous cavity with this denser material that we already had available that we use for retinal detachments. And silicone oil is a lot denser than water, which is essentially what composes the vitreous humor. And we found that by increasing the density of the vitreous cavity with silicone oil, we could reduce radiation exposure to healthy tissue in the eye. And early on, we published several papers showing that it reduces radiation retinopathy, and we actually get improved vision in patients by 2 years compared to if we just do straight radiation treatment alone. And I think this is something that is still emerging because a lot of ocular oncologists either are not vitreoretinal surgeons, so don't have this available, or they may be vitreoretinal surgeons, but their ocular oncology training is very isolated from their retina training, so they don't really marry the two. And in our fellowship program, we do strongly bring together a lot of vitreoretinal surgical techniques to help our ocular oncology patients. And this is one very, very great advance where we can actually prevent the radiation damage before the treatment. And it doesn't eliminate it because people still may need anti-VEGF and other treatments, but it is a huge step forward in trying to get the best vision for patients. I think the last thing that I'm continuing to work on right now is just the value of educating patients. And I'm very excited about the work that I'm doing in health psychology with my collaborators in the Department of Psychology at UCLA. We are looking at sort of our mindsets and how we think about our cancer and how that can actually change our clinical outcomes. And super excited about this, but my big thing that I really feel strongly about is patient information, patient education. Getting people involved actually makes them do better. So, I believe that if we can help our patients understand things and reframe this whole journey of cancer, it's going to change their outcomes. So that's something that I'm very passionate about, and it does tie into sort of wellness that you brought up. But it's been a learning journey for me because this is a way of approaching medicine that I hadn't really considered before. So very excited about those things.
Going back to the silicone oil idea, the idea of attenuating the dose of radiation to viable retina, decreasing the risk for radiation retinopathy, that was an idea that came out of of your work with actually a fellow at the time, right? Scott Oliver, who's now
Yes.
the fellowship program director over at the University of Colorado. So tell us a little bit about where that idea started.
Yeah, well, so one of the, obvious real joys and benefits of being at UCLA is the working with our fellows. And Scott Oliver, who was a phenomenal vitreoretinal fellow, never was satisfied with how things were going. He'd be in tumor clinic and he'd say things like, why is everybody counting fingers vision, or what how can we tolerate all this poor vision in ocular oncology? And we would talk about it, and he came up with the idea that we could maybe replace something, or shield the radiation. And we worked with our physicists. We have a very robust radiation oncology department with a team of really forward-thinking physicists who don't just, take our prescriptions and make our plaques. They actually come up with ideas that we ourselves might not be thinking about. And so we did an in vitro study where we looked at silicone oil, we did some animal studies, and the paper that is authored, Scott Oliver is the first author on this paper, really showed that this makes a huge difference. And so it's working with people like Dr. Oliver and our fellows who come up with these ideas and keep us on our toes and keep us asking questions that really sort of spur us on to doing new and novel things. When you have somebody like a trainee who's never been in a certain field and they're looking at things with fresh eyes, we need to just run with all those things. So I really, part of being a fellow in our program is, our faculty being open to making changes and, being open to changing things so that it's not sort of what we've been doing for the past several years. And that's one thing I'm really proud of our program is that, if you look back 3 to 5 years, we're doing things differently every time.
No, absolutely, and that's true. Coming to a clinical problem with sort of a blank slate is really can really pave the way for innovations. I wonder
Absolutely.
if you might talk a little bit about, as you're many of our listeners maybe are thinking about going into retina. The process of selecting vitreoretinal fellows for a program is increasingly difficult because, gosh, everybody looks amazing. I mean, many multiple
Absolutely.
great training programs, multiple publications, huge contributions, even as residents, medical students, et cetera. Uh, how do you how do you get through how do you decide who you're going to invite for an interview and then, subsequently choose to be a fellow?
That's such a great question, and you're absolutely right. Everybody looks phenomenal on paper. And I think, we sort of look at, people's outside interests, how has a certain individual sort of shown their commitment to maybe not necessarily even say retina, because I do know that many of our residents, they stumble upon retina later in their training. So a person who can demonstrate commitment in a certain area and follow through with a project, oftentimes having a research publication or several are good signs that a person can start a task and complete it, because actually ending a research project with a publication requires a certain amount of dedication that, it's easy to just start a project and then it just disappears. But if you actually finish it to publication, that says something about an individual. So, research publications, your outside interests, how did you come upon this idea that you want to do surgical retina and be a retina surgeon? These are it's sort of a combination of these things. Your extracurricular things are important. What do you spend your time on when you're not studying and working hard? That kind of helps us get some idea. But even then, it's very difficult. So we do interview a lot of people because I think it's really important to, meet people in real life, and find out what they're like, what they, are they going to be a good fit for our program? And our program is it's very intensive because it's very heavy on the surgical exposure component, and our fellows are really it's a fast entry. There's not a sort of a slow 6 months of sort of being in the clinic. You're really starting with hitting the ground running. So are you able to are you able to be unafraid of being in challenging situations and working really hard and really supporting your training with reading and studying and doing everything it takes to be the best possible doctor? And we want to see people who sort of embody that spirit, that you don't have to have much knowledge coming in. And a lot of times fellows or fellow applicants will talk about, oh, I've done X number of core vitrectomies. Honestly, if you've never done a vitrectomy, it doesn't matter because we want to train you on that. We want to just see commitment and dedication. It's really hard. As you know, there are some really excellent applicants, and we really do what we can to get to know everybody and try to figure out who would be a good fit in our program.
Yeah, absolutely. It's a relatively small community, so, letters of recommendation, communication
Absolutely.
with faculty mentors is a huge component of that process as well. So, for candidates who are looking at different programs, what are some of the things that you think that they should be paying attention to? What are some of the features of programs that you think make a particular program strong?
Well, I think a few things. I think, how are the current fellows enjoying the program? So spend your time talking with the current trainees, the fellows specifically, and what their experience has been like. I find that oftentimes it's learning from the people who are actually in the middle of it and learning about what they found was challenging, how they do their learning. Get the inside scoop from the people who are there. I think that's really helpful. And if possible, if you can speak with or hear from people who have graduated from the fellowship training program and find out how they're doing in their careers, how was the transition from fellowship to practice. I think that's very helpful. I would say also speak to your mentors. I feel like now a lot of us in different programs have had a very different, people have this varied experience of training, and people are, we're a lot more, it used to be just everybody at one training program only trained there, but now most places there's a lot of cross-pollination. So ask your mentors, what their experience is, what do they think? Um, I think, so doing your own research before you actually come to your interview just helps you be able to sort of solidify specific questions and sort of verify what you think you've heard. I think that can be very helpful. I'd say those are my main tips to consider.
Yeah, absolutely. All great points. The part of being a fellow is to actually learn by doing. That's a huge component of the surgical learning. Obviously, you can't just watch somebody else operate. Can you speak a little bit to how there should be a progression in surgical learning, graduated autonomy, and what your and the UCLA approach has been?
Yeah, that's such an important topic. And it's a question that a lot of our trainees are wondering about as well. So I'm happy to shed some light on it. Um, Learning surgery can be difficult for the fellow, but also for the attending. And, because these are often, when you're working with attendings who you're getting your teaching from, they're often their own patients. And attendings are, we're all very, we need to look out for the best interests of our patients. So you may find that this process begins slowly. There's always some watching and observing before you begin. It's unusual that immediately just jump in without any skills, or you just, okay, now just go for it. You really, I think most of us want to see that you understand sort of the principles behind the case. So what I would recommend that you do is to read up on the cases on your attendings list, understand what is the reason that surgery is happening, learn about the patient's history. Have they had multiple surgeries? Is this a first time vitreoretinal surgery? So learn, be very familiar with the patient themselves, and then also sort of already think about your own surgical approach, because we assume that fellows, before they come to the OR, have done reading, have read about basic vitreoretinal techniques, understand retinal diseases. So this is a process that is a continual process in the background, that you're not just coming to the operating room and doing your learning. You are supplementing that with learning on your own time, that read from cases. You may be reading books, you may be sort of looking at articles or videos related to surgeries that are upcoming, or that you're sort of planning to learn about on sort of in your own learning schedule. And I encourage fellows to sort of come up with their own learning plan, and it's very important to do this alongside with your clinical experiences. um, Fellows who already have an understanding of the disease, possible surgical approaches, and come in ready, those are people that I want to give the cases to, because it's very exciting to work with a person who has engaged and is super interested and is like chomping at the bit. I mean, I want those people to learn. And so all those things really help accelerate your learning instead of it kind of going slowly. The other thing that is really helpful too is a lot of programs have IC surgical simulators, and the vitreoretinal models are really great. And the cataract models are really good for capsulorhexis that you might have used during your residency, but the vitreoretinal models are really good for getting a good sense of what it's like to be in the eye, holding instruments, and even for membrane peeling. They're really, really true to life. So I encourage fellows to start, doing training on the IC simulator. And then when you come to the OR, you tell your attending that, I've been doing A, B, and C on the IC, and this is what I found. I mean, talk about what your training has been. And I think that really sort of being just sharing with your attending what you've done, where you're at in your reading, just let them know. Let people know that, I'm committed and I'm here and I'm learning, and I want to fill in the gaps when I'm actually with you during your day. I mean, I'm just sort of painting a picture of the sort of ideal scenario that, if I could create a fellow in training, because when you work with a person who is so engaged and has been so prepared, you just, you just get excited about teaching them. So I would encourage fellows to to this transition of starting your fellowship, really prepare yourself and really be committed, because, ultimately, we want to graduate people who are going to look after patients and provide the best possible care. And even, if we ourselves need surgery someday, we want to feel like our trainees, can operate on ourselves. So that's sort of how I look at things. And it's just really important that we're all very committed to helping our trainees in this process.
Yeah, no, couldn't agree with you more. And so true that what you put in is really what you get out. Actually, you get out tenfold what you put in. And it's such a special time in life, to spend 2 years to really learn as much as possible. It's a unique opportunity to be able to learn different techniques from different attendings. And it's really important for, I think, fellows to take full advantage of those 2 years and really immerse
Yeah.
themselves in that
2 years
process.
is 2 years is short. It is such a short time. Really, if there's anything that you can defer or put off or whatever it is, like just think of these. This is a very, very, very finite and tiny period of training that you can learn and grow so much. Can't emphasize that enough. You said it.
Yeah, and learning, learning is a lifelong process. And so getting into that mindset, hopefully, fellows are already in that mindset before they even come, but getting into that mindset of, look, this is a constantly evolving field. And
Yeah.
at the beginning, you're learning the basic, building blocks of how to do vitreoretinal surgery, but staying on the cutting edge really requires ongoing reading, staying up to date on the literature, watching videos. There's all sorts of different ways to continue to learn.
Absolutely.
Um, another important part of fellowship is really the breadth of experience, and we're fortunate to at UCLA to have so many people and so many different subspecialties within retina and ophthalmology that are complementary to retina. I wonder if you might speak to how UCLA's program is structured and that sort of breadth of experience.
Yeah, no, you're absolutely right. We do have so many opportunities to sort of go to other areas within retina. And I think some of our strong points are, we have uveitis that our fellows get to work with. We have a uveitis specialist, Dr. Edmund Choi, who does a lot of posterior uveitis and really enjoys working with our fellows. So we're really fortunate to have him and all of his experience so that you can be comfortable with uveitis cases. We have Dr. Irina Sway, who does pediatric surgical retina, and you get a lot of experience with babies and ROP. These are really important experiences because a lot of places that you might go and work require some additional knowledge. So these are important. I mean, ocular oncology, I goes without saying, we have fellows who have gone through our vitreoretinal fellowship training program who now do tumors. At least four individuals who this is part of their practice. So, we can offer a lot of additional expertise in addition to the bread and butter retina. I think our program, just to touch on, how things are structured, we have two county hospitals where our fellows really can kind of, set the schedule and choose cases and receive mentorship with faculty who operate with them. And there's a certain amount of graded autonomy as you get more and more comfortable. And our county hospitals serve patients who are more ill. So there's a lot of advanced diabetes and diabetic retinopathy cases that are felt nothing is difficult after you finish a UCLA vitreoretinal surgical fellowship. So, that experience is great. We have a number of faculty at our outside hospitals. We have Dr. Jay Sridhar, who's at all of you. Harbor County, we have you. We have Dr. Hosseini. And then we also sometimes we have other people in the community who are retinal surgeons who you may get to operate with once in a while. So you'll actually get to see how other people who are sort of outside our sort of official faculty operate and practice. And that can be very valuable. There's a lot of differences, and getting that exposure is just going to add to your learning. We have a VA hospital as well that has sort of a little bit more bread and butter type cases, but the breadth of cases and experience is very broad at UCLA, and I think that's what really that together with faculty who have training all over the place really brings together a lot of experience for our fellows.
Yeah, no, absolutely. And not to mention the opportunity to work with some of our medical retina experts who are leaders in
Absolutely,
imaging
yeah.
is such a huge part of how we manage patients now, both medically and for increasingly for our surgical patients. Imaging can play a huge role in how we decide on surgical management and prognosticate, et cetera. Um, let's sort of shift gears a little bit towards wellness because
Yeah.
this is importantly an increasingly talked about component of professional life, whether that be in training and beyond. And there are a variety of factors I think that are contributing to, sometimes physician burnout is a big concern. So can you talk a little bit about what you recommend for physicians, both in training and beyond, what they can do to support their wellness and avoid burnout?
This is a loaded question, and if I had the answer, we'd all be good. Burnout is sort of it's sort of this thing that can happen to people who are, very busy, and burnout is specifically associated with feeling lack of appreciation for what you do. And sort of just feeling undervalued and sort of feeling that what you do kind of doesn't really make a lot of difference, and you sort of get a little disheartened with practicing medicine and being a doctor. And there's, we are fortunate to be in an institution where burnout and physician wellness is a very big priority. So there's a lot of things, to sort of consider as to apply a few things to your own career and how you pursue your training and eventually practice. And it's really important to take time to do other things in addition to only clinical care. So, you may join a practice and, there may be hours of patients to see, surgeries, and you're just constantly going. So you need to have a break. You need to, have, if possible, have a day or a half day where you're really not doing anything clinical and you're pursuing something totally outside of medicine that is really meaningful to you. And I think it's easier said than for people just to go and do that. But, all of us have hobbies, passions that we are curious about that are not related to medicine. And it's just, it's a normal thing we all do. And it's important to sort of cultivate some of those things so that you feel that you're sort of more multidimensional. I mean, this is sort of what I've learned working with people and when I attend meetings in integrative medicine and wellness, it's just sort of being able to pursue these other things that are important. And then the other big thing is also just really maintaining personal connections, friendships, whether they be colleagues that you meet in your path in medicine or outside, making time for friends and getting together with people. I find that, there's been studies on this, but as people get older and go through life, we start losing our connections. When we're in college and training, maybe early career, there's a lot of opportunities to connect with people. But as we go through middle age and we get to our senior years, isolation and loneliness contributes a lot to, a poor wellness. And so maintaining friendships, doing things that are meaningful to you, and taking time. One thing that I've learned is that seeing more patients and being busier is never the answer. So kind of doing things like, you're doing this amazing podcast and, using some skills that you have to educate other people because that's meaningful to you. This is helping your wellness. So, being able to do this. And I think just being aware of things and noticing how you're doing. And, if you're sort of starting to have trouble sleeping or you're starting other health issues are coming up, it's really important to notice them and pay attention to how you're doing and address them. And, it's very difficult because as things change and technology changes and our world is changing, how we define being burned out and how we define wellness also is going to change. So those would be some tips I would share.
Yeah, no, great tips. The interpersonal relationships are so critical to our well-being. And part of that is also with our family. And I wonder if you might speak a little bit to, finding that balance between, maybe work-life balance is now a misnomer, because it's all part of our life. Work is part of our life, but carving out time for family. You're a mom to three amazing young men and super active, and you're super involved in their lives as well as being, incredibly busy professionally. How do you do that? How do you manage all of those different demands on your time?
Um, you, it's hard to plan anything like this. And I like, we were talking about earlier, you just sort of things work themselves out and you just have to decide what is a priority. And with children and childcare, it's we're a very hands-on family. We don't have nannies, we don't have drivers, we've decided that we're going to be the ones doing that because our relationship with our children is like 90% of what we can give them, and I think that even as professionals, and I may be speaking to others who are sort of thinking about, is now the right time to start the family? When you have a child, it's, the most important thing you can do is sort of be close to your child, share with them the things that and model for your child. And if things like looking after yourself, pursuing passions, all the things that you do for yourself, sort of that your child picks up on all that. And so, we wanted to be very hands-on. We wanted to prioritize them. And, it's also saying no to a lot of things too, and I think it gets easier to say no to things when you're further along in your career. When you're just starting, it's probably better for your own growth and development to take on a little bit more so that you can learn what you enjoy and what you don't. But once family comes into play, you just work around them. And I feel that, a lot of times um, things work out because people appreciate what you value as important. And And I think a lot of it resonates with people, our colleagues, and the leadership in our department. We have a very supportive department in terms of um, you know our work responsibilities and time for admin, and all the hours in the day are used for something, and if it's not work, it's family. And I just think that it's different for everybody. And so I'm trying to share with you a little bit about what's worked with us, but I think just sort of being hands-on, we really value that, being available for our kids as much as possible. And when you start to have kids, you're not going to every single meeting all the time, or you're really shortening some of those things. But what you do in your career and what you do in your family, it's fluid, and you can sort of change and make adjustments, and you can still contribute and maintain your teaching responsibilities. But it's challenging, and you sort of have to be on your toes. And I always think that we only have a very limited time with our kids, and when they're off, hopefully to college and other things, we're going to have more time to spend on whether it's more career related things or other interests. Like life is very short, and we just have to figure out what makes sense to us. And it's really important not to, there are no ways to do it, or if you're having children, or you're trying to combine your career and trying to raise a family, there is no one way, and you just have to figure out what works with you. And things tend to, as long as you sort of hold key what's important, that you want that time for your family and you want to spend time in with the trainees, things kind of shake out, but it can be challenging, and you have to address each thing as they come up. I hope
Yeah,
that
no,
helps answer.
No, absolutely. I couldn't agree with you more. And what I found too is that it sometimes it's not, we want as much quantity as possible, of course. Time is so valuable, but
Absolutely.
sometimes it's also really about quality, just spending time, even those sort of micro moments when I'm, for example, driving my daughter to her dance lessons, it's just the two of us in the car, and we can just talk about her day and talk about what's going on in her life. And I find that even the small things in life, actually, those are the greatest joys, where you can spend some quality time with family, even doing mundane tasks.
Absolutely. I agree with you. That's a big thing to drive your daughter around. It's so many opportunities to connect with her. So that's you're doing exactly what I'm talking about.
Yeah. Well, I want to go back to what you had talked about, finding other things to do in life, or other hobbies, or other things that bring meaning to life. And I know that, music has played a huge role in your life. I had the good fortune of watching you perform at the Coburn School of Music in Los Angeles. It was actually a competition. It was a huge honor. You were chosen as the winner, and gave a absolutely amazing performance. And for those of our listeners who don't know, Tara, you're a virtuoso pianist. I mean, you could have become a professional pianist. And I wonder if you can talk a little bit about how music has played a role in your life, and also, how the decision of, choosing medicine as opposed to pursuing a musical career.
Yeah, yeah, those are big decisions that were an earlier part of my life, and a lot to consider. Music and learning the piano, many of us in ophthalmology have musical interests and have learned instruments, and probably to a very high level. I know many people who do in ophthalmology. And learning music has just been music for me is just all about sharing emotion. And that's really ultimately what really drives me to play and perform and look for opportunities to do this, even though it's a huge time sink. For anybody who plays an instrument, or I'm going to say piano, there's hours of learning and memorizing and really polishing off something to performance level if you're going to go all out. And if I'm going to do it, I'm going to go all out. So that competition was it taught me that I can learn new music. I don't have to go back to old music that I've done in my past. And that was like a piece that I had learned literally like 3 months. And so it was a challenge for myself to put it all together and then deliver it and experience absolute joy by performing it, and sort of sharing emotion. And I think music and arts really taps into a different part of ourselves than, say, medicine. And sharing our emotions, and it's another way of just connecting with people and sort of having, your raw self out there. And for me, it's exhilarating to be able to do that and to really change listeners. And there are some glimpses in medicine where the same thing happens, but it's not as often as when you're like in the arts. Um, and I think when I think back to it was like, I guess in high school, college, thinking about going to music school or not, I did have a teacher. I had a number of music teachers back then, but one of them said to me, Tara, if you're thinking about whether you should go into music or science, you can't go into music, because people who go into music for their careers and for their livelihoods, it's not even a question. It's something that you have to do because you would be dead. Life wouldn't be the same if you could not be doing music all the time. And so I was like, I can stop doing music for a while, and it's not like, it's not the end of the world. I have other things. And so that was really clear to me. I have friends who did go into music, and it's a very tough journey. It's like, if you want to be a performer, as there are only a handful of very well-known like pianists in the world. And it's very difficult. And I thought, I definitely don't want to default into teaching music at a community college somewhere or wherever. And so I thought, I'm going to pursue some other things. And so, um, this is sort of what goes through my head. Like, it's a calling if you're going to pursue music. And so fortunately, a lot of us here listening have a lot of different interests that we can pursue and that we have the ability of going for. And I think it's great to be able to switch gears and be a musician for the periods of time, and then kind of go back to being a doctor and, helping patients.
Well, we're all fortunate that you found your calling in ophthalmology and in retina. I want to thank you so much for taking the time to chat with us. I think that so many of your thoughts will benefit all of the physicians who listen to this podcast. So thank you again, Tara, and we're looking forward to all the things that you're going to do as a new fellowship program director at UCLA.
Amazing. Thank you so much, Pradeep. It's a real honor to speak, and good luck to all fellows and people thinking about fellowship. It's exciting out there.
If you enjoyed this video, please visit us at RetinaRounds.com. There you can sign up for our email list. You'll get a notification every time a new video is posted. And if you have an interesting video or a tip or trick that you'd like to share, please follow the links on our website and you can upload your video there. Thanks so much for watching.